Hi everyone, our case study is number 3B, Tubal Ligation for medical reasons. My name is Kyla, and our case study is about Maria. Maria is a 28-year-old woman in the 26th week of her third pregnancy. She is obese, a heavy smoker, has used weight loss pills on several occasions, and she suffers from type 2 diabetes mellitus. Her previous 2 pregnancies were complicated. Maria presents with complaints of progressive exertional dyspnea and fatigue of several weeks' duration. She also reported several recent syncopal episodes. After a variety of tests, she was admitted to labor and delivery at St. Michael's Medical Center and was prescribed bed rest, oxygen, diuretics, and heparin. Despite this therapy, Maria continued to report progressive dyspnea. At 32 weeks gestation, the placement of a pulmonary artery catheter demonstrated moderate and primary pulmonary hypertension, presenting a significant risk to the mother. Maria was treated accordingly. At 36 weeks gestation, the patient suffered premature rupture of membranes followed by active labor. The progression of labor was insufficient and a C-section was performed, resulting in the delivery of a healthy baby boy. At the recommendation of her OBGYN, in order to avoid future life-threatening pregnancy, a bilateral tubal ligation was performed with the patient's consent. Post-delivery, the patient was treated in the ICU unit for 5 days for her primary pulmonary hypertension. She was discharged 20 days later.
Hello, this is Eana, and I will be identifying the ethically salient elements of a case, and in Maria's case, we chose beneficence and autonomy. Moving on to the next slide, we go deeper into both of those ethical principles. So on the left, we have beneficence, which is an action to benefit someone, doing the most good and removing any harm. And in Maria's case, it is the benefit of having the tubal ligation, which was to prevent future life-threatening pregnancies to the patient and to prevent future pregnancies that may cause harm to the fetus. As for autonomy, it is the ability for the patient to make their own decision regarding their health care. And the patient made the decision to complete the tubal ligation, the patient meaning Maria, and she was also able to weigh the risks versus the benefits of tubal ligation to prevent a future pregnancy. So these two ethical elements most fit Maria's case because we are providing her what is best for her, which is what benefits her the most. And also autonomy, we were able to provide Maria with the information she needed to make the decision because having a tubal ligation is not a light decision to make.
Utilitarianism. It is a moral theory that explains that an action can be considered good or bad in relation to its end result. So as referring back to the case study where our patient or Maria has a tubal ligation for medical reasons, and it is due to the fact that she's having a risky pregnancy, with the fact that she is having difficulty with breathing. This is her third pregnancy, and again, the previous 2 were difficult too. So it was just a good reason to cut her tubes in order to prevent future complications. And patient was able to provide consent and able to understand that it is for her own good too, and to stay healthy for her 3 kids. Deontology. It refers to the fact that certain behaviors are right or wrong regardless of the results. This really emphasizes the ethical elements of autonomy, making one's own decision. So it regards if this is ethically right or wrong. It's just that we are to respect human rights, and whatever Maria's decision about her pregnancy or health is her own right, and we are to respect it as a healthcare professional. Virtue ethics. It holds the individual's ethical behavior that is measured by their trait-based characteristics such as honesty, courage, and wisdom, rather than the consequence of their own actions. fortitude, standing firm for what is right in difficult situations, even if potentially costly to oneself. I'm not sure about costly to oneself, but then again, for this client, and her getting a tubal ligation was just a medically necessary, or I would say the correct pathway for her, since she had difficulty with her pregnancies previously. And again, it is for her own health and good that she is to stay healthy so that she can take care of her kids or children. And lastly will be nursing principles. It is a right to do good for patients, and while honoring the client's wishes is crucial in this special case scenario. So it is talking about the beneficence and autonomy. Again, as healthcare professionals, we would like to respect what the client's decision is, but we are still needed. We still need to educate clients on what we think is correct, and still respect their wishes for their own health care.
Proposing an informed contribution to the resolution of the case by Zully Andrade. Patient education and support. What we will do is provide an extensive patient education and support to Maria regarding the importance of lifestyle modifications, including smoking cessation, weight management, and glycemic control to improve her overall health and reduce the risk associated with her medical conditions. With that, understanding and grasping the variations of Maria's medical condition includes her past medical history, current pregnancy, complications, and associated risks. Another thing that we can contribute as a proposal is working with the multidisciplinary care team. We will establish a multidisciplinary care team comprising obstetricians, pulmonologists, endocrinologists, nutritionists, and mental health professionals to provide comprehensive care tailored to Maria's complex medical needs. With that comes collaboration, recognizing the importance of interdisciplinary collaboration and patient-centered care involving relevant healthcare professionals and engaging Maria in shared decision-making.
Here are the directives that can be applied to this case study. Directive 53 states procedures that induce sterility are permitted when their direct effect is the cure or alleviation of a present or serious pathology and a simpler treatment is not available. Directive 27 states free and informed consent requires that the person receive all reasonable information about the essential nature of the proposed treatment and its benefits, its risks, side effects, consequences, and cost, and any reasonable and morally legitimate alternatives, including no treatment at all. Directive 37 states an ethics committee or some alternative form of ethical consultation should be available to assist by advising on particular ethical situations, by offering educational opportunities, and by reviewing and recommending policies. Directive 43 states a Catholic healthcare institution that provides treatment for infertility should offer not only technical assistance to infertile couples, but should also help couples pursue other solutions such as counseling and adoption.
Hello, my name is Nicholas Narciso, and today I'll be answering the question of how directives might help address the ethical issues that my group had identified throughout the case study. So first up, we have induced sterility. So this directive allows Maria to make a proactive choice to prevent future pregnancies, while also considering the potential risks associated with her medical condition and lifestyle factors. Secondly, we have informed consent. So by obtaining informed consent, the healthcare team can respect Maria's autonomy and empowers her to participate in decision-making regarding her care. This directive also fosters trust between Maria and her healthcare providers and promotes shared decision-making, ultimately enhancing the ethical delivery of care. Next, we have facilitating patient with support. So because this directive aims to address Maria's holistic needs, including physical, emotional, and social support throughout her pregnancy, by offering comprehensive support services, the healthcare team can enhance Maria's well-being, optimize her pregnancy outcomes, and mitigate potential complications. Lastly, we have infertility interventions. So infertility interventions may be relevant in addressing her reproductive health needs. For example, a tubal reversal surgery could be considered. This directive underscores the importance of respecting Maria's reproductive autonomy and ensuring that she has access to a range of fertility options that align with her values and goals.